We're here today for the release of RNAO's 2SLGBTQI plus best practice guideline. If you have any questions during today's presentation, please use the Q&A box that is at the bottom of your screen. Please also note that this is being recorded. I'd like to begin our session with a land acknowledgement. We recognize that our work and the work of our members takes place on traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of the RNAO is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and most recently, the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that the participants of RNAO's AGM are located in other traditional lands across Ontario. Today, this meeting place is still the home to many First Nations, Inuit, and Métis peoples from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back over 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. June is Pride Month in Ontario, and I am so pleased that we have assembled today to present a new RNAO best practice guideline promoting 2SLGBTQI plus health equity. RNAO has a reputation for promoting inclusivity, and this best practice guideline is just the latest example of that work. Our speakers today are Sheena Howard and Elizabeth Sawick, promoting 2SLGBTQI plus health equity BPG co-chairs, as well as Amy Burt, RNAO guideline development methodologist, and Paul-Andre Gauthier, RNAO's Rainbow Nursing Interest Group provincial president. During today's event, we will be introducing the Promoting 2SLGBTQI plus health equity BPG, including a discussion of the background and scope, an overview of the BPG development, and highlighting some key recommendations. Following that, we will hear from the Rainbow Nursing Interest Group, who will share the details about RNAO's position statement to be released. In closing, there will be an opportunity for a few questions. First off, I will pass it over to Dr. Elizabeth Sawick, co-chair of the BPG's Expert Panel.
Thank you. The 2SLGBTQI plus acronym in this BPG stands for Two-Spirit, Lesbian, Gay, Bisexual, Trans, Queer, and Intersex people. The plus is meant to be inclusive of other people who identify as a sexual or gender minority, for example, pansexual, asexual, non-binary or genderqueer, or other identities. The 2SLGBTQI plus acronym used in this document was selected by the expert panel to call to mind the diversity within sexual and gender minority communities in Canada and across the world. 2S for Two-Spirit was chosen to lead the acronym in line with its usage in other recent reports as a way to honor and make visible the presence of Two-Spirit Indigenous people and their experiences. Addressing the health needs of 2SLGBTQI plus communities is essential. Research has shown 2SLGBTQI plus people have historically been silenced and face prejudice, discrimination, and violence. These contribute to poorer health outcomes for 2SLGBTQI plus people compared to cisgender and heterosexual peers, leading to persistent health inequities. The stigma and discrimination within the wider society is also present in the healthcare system, where 2SLGBTQI plus people experience poorer care and differential treatment, making those health inequities even worse. And discrimination due to their 2SLGBTQ identity may not be the only forms of oppression they navigate. Health inequities for 2SLGBTQI people may be compounded for those who are Two-Spirit or other Indigenous people, or for those who face racism, ageism, or ableism, along with discrimination based on sexual orientation, gender identity, or gender expression. Our objective was to create a best practice guideline that provides organizations and practitioners with inclusive and affirming practices to improve healthcare access and quality of care for 2SLGBTQI plus communities. The work was guided by an intersectionality framework, an anti-oppression lens, and health professions' accountabilities to the Truth and Reconciliation calls to action. The guideline provides evidence-based recommendations for nurses and the interprofessional team on fundamental inclusive care practices, as well as health promotion and health care for individuals within the 2SLGBTQI plus community. This includes health promotion and chronic disease prevention, management across the continuum of care, including acute care, community care, and long-term care settings. I should note, the guideline does not include recommendations on prescribing medications. In the same vein, the guideline does not include recommendations focused on acute, specialized post-surgical care for individuals who have undergone gender-affirming surgical procedures. But within the BPG, we refer readers to other high-quality evidence-based resources on these topics in the appendix. Now I'm going to pass it over to Sheena to describe the guideline expert panel and those involved in the work.
Thank you, Elizabeth. As mentioned, Elizabeth and I were selected as BPG co-chairs. The rest of the panel is made up of 14 inspiring individuals. The panel included diverse representation. The RNAO expert panel included persons with lived experience, and it was interprofessional in composition and was comprised of individuals with knowledge and experience in clinical practice, education, research, activism, that was across a range of health service and academic organizations, practice areas, and sectors. These experts shared their insights on supporting caring for 2SLGBTQI plus people across the continuum of care. For example, in acute care, long-term care, rehabilitation, primary care, and in the community. I would like to acknowledge and deeply thank the RNAO team that was involved in bringing this BPG to life, including guideline development, evaluation, and senior management staff members. Next, I'm going to pass it over to Amy to tell us a little about exactly how this BPG was developed.
Thank you, Sheena, and it's a pleasure to be speaking in front of you all today. Before we get into the methodology and how we developed this best practice guideline, we would like to provide a little background to the best practice guideline program at RNAO. The RNAO Best Practice Guidelines program is founded on an integrated BPG model, including guideline development, dissemination, implementation and sustainability, as well as evaluation and monitoring. At RNAO, when we develop guidelines, our intention is to support the uptake of guidelines into practice through supporting dissemination and implementation. We do this through a multi-pronged approach that includes individual, organization, and system-level strategies. Additionally, we have a robust approach to supporting monitoring and evaluation so that organizations can know what impact the guideline is having on persons, providers, organizations, and systems. Our BPG development follows 6 rigorous steps: topic selection, determining a panel of experts, a systematic review, or in our case, several systematic reviews, recommendation formulation, a stakeholder review, and finally, publication. Within our systematic review and recommendation formulation process, we align with a gold standard approach known as GRADE and GRADE Circle. This stands for grading of recommendations, assessment, development, and evaluation, or for qualitative evidence, confidence in the evidence from reviews of qualitative research. Our systematic reviews were aided with the help of a health science librarian. We asked 8 research questions and screened over 66,000 articles. Of these, almost 1,000 full text were examined for relevance. And finally, 203 articles were included to inform the 10 recommendations in the BPG. Through the systematic review process, we did identify several research gaps. The full list and details are available in the BPG. 4 key research gaps we wanted to highlight today were, firstly, the need to include and report on two-spirit and intersex people in the evidence. Both of these groups were seldom present in the evidence, which could pose a barrier to future health service planning. The development and validation of mental health screening for 2SLGBTQI+ people was also an identified gap. This is a need across the lifespan, but was particularly noted as a need in youth. For example, for suicide screening in trans youth. Further research focused on integration of 2SLGBTQI+ health content into education for students in health professions was also noticed as a gap. Although there was a fairly large quantity of studies in this area, most studies were not conducted in a Canadian setting and were not of a robust study design. Finally, the impact on health outcomes and quality of life of 2SLGBTQI+ specific spaces for older adults, such as in long-term care, retirement, and assisted living spaces. There is certainly a need for further work to support 2SLGBTQI+ older adults. I'm going to pass it back over to Elizabeth now to tell us a little bit more about the recommendations in the BPG.
Thanks, Amy. There are 10 recommendations and one good practice statement that fall into 5 broad categories in the BPG. Some are foundational to all practice: inclusive communication, safer spaces, and then some are more clinically focused: risk assessment and screening and group-based interventions. And then the final broad category is education. The recommendations are applicable across the lifespan. Where possible, we've included details from the evidence that speak to ages and particular life stages. For example, in our Safer Spaces recommendation, we've included details that emerged from the evidence, such as the need for 2SLGBTQI+ inclusive and positive programming in retirement homes and long-term care facilities, and adequate training on 2SLGBTQI+ older adult health. Next, I'm going to dive a little deeper into 3 of the recommendations in the BPG. The first recommendation that we're going to focus on is Recommendation 1.0 on inclusive communication. The recommendation reads, the expert panel recommends that health providers use 2SLGBTQI+ inclusive language and a person-centered history-taking approach, and ensure privacy and confidentiality during interactions with all people to be inclusive of 2SLGBTQI+ people. I'll speak to this in a little more detail in the next slide. Inclusive language avoids using words, expressions, or assumptions that would unnecessarily exclude people. In particular, in the evidence we reviewed, LGBTQ+ people reported feeling safe and comfortable when health providers used gender-affirming language and avoided heteronormative and binary language. Participants in several studies described how they must be called by their chosen name and the correct pronoun and title, Mr., Ms., or Mix, in order to feel safe and comfortable during care. A person-centered approach involves advocacy, empowerment, and mutual respect, and understanding of a person's right to be autonomous, to self-determine, and to participate in decisions about their health. Overall, 2SLGBTQI+ persons feel comfortable and safe when health providers avoid asking questions that are not relevant to their care needs or are based on heteronormative assumptions or assumptions about a person's sexual orientation or gendered identity. This was particularly evident with regard to taking a sexual health history, including sexual behaviors and relationships. Strategies for providing care with enhanced privacy and confidentiality that emerged from the evidence included being open and explicit with provisions for maintaining privacy and confidentiality, spending time during the first visits to establish confidentiality, allowing people to opt out of data collection or data storage, and being vigilant in physical environments where conversations are not private or could be overheard, such as emergency department waiting rooms. The second recommendation that we're going to discuss is Recommendation 4.0 on group-based intervention. The recommendation reads, the expert panel suggests health service organizations implement specialized 2SLGBTQI+ clinical groups for health promotion and chronic disease prevention and management. Group-based interventions in the evidence were targeting specific health conditions, such as diabetes or anxiety, or behavioral risk factors for chronic diseases, such as tobacco cessation or weight loss. Some of the key similarities of the group-based interventions in the evidence were stakeholder and community involvement in the design, empowerment-based approaches. Empowering clients is based on the premise that people have the right to make their own choices and decisions around their own health. The use of peer facilitators in the delivery of the interventions, opportunity for group discussion, and the delivery was typically multi-session, and a variety of approaches to delivery were used, including in-person, online, social networking, and telephone. Finally, Recommendation 5.0 focuses on education for all students entering health professions. The recommendation reads, the expert panel recommends academic institutions integrate 2SLGBTQI plus affirming health content into curricula for all students entering health professions. Affirming health content cares for people and supports an individual while recognizing and acknowledging their sexual orientation, gender identity, and expression. Health content in the evidence was focused on three main areas: theoretical content, self-reflection, and experiential learning. Theoretical content was inclusive of cultural safety. Many studies also focused on terminology, history taking and assessment, health inequities, mental health, legal issues, and trans-specific content. Now I'm going to pass it over to Sheena to offer some thoughts on this BPG overall and its potential impact on 2SLGBTQI plus health. Sheena?
Thank you, Elizabeth. We have big hopes for this best practice guideline and the ways in which it could impact care and health equity across the globe. Can you imagine how this BPG could influence the care of my 2S LGBTQI plus brothers and sisters in places where it's illegal to be who we are? We can, and it could very well be life-saving. This BPG can also significantly help closer to home, right here in Ontario. For example, when I was trying to get pregnant with our first child, and I injured my arm and we were undergoing fertility treatments and I became pregnant, I went to see my family doctor and they prescribed Arthrotec. And for those of you that aren't familiar with the ingredients to Arthrotec, misoprostol, one that helps to support medical therapeutic abortions, is included in that drug. So indeed, he didn't ask me if I was planning on becoming pregnant. He assumed that because I was a lesbian, we weren't trying, and I lost our baby. Or trans care. In Ontario, I've been involved in supporting over 400 trans folks from across the province. Had this BPG guideline been present, along with the Sherburne guidelines and the RNAO work that's been done, those clients could have received care perhaps closer to their home with their own primary care providers, improving access and care in a timely manner. Next, I'm going to pass it over to Amy for some housekeeping details before we wrap up.
Thank you so much, Sheena, for telling us your story. So the BPG will be freely available for download, or actually is already freely available for download at the website listed on the screen. And additionally, if there are further questions, you can always contact the RNAO team on our website. Before I move ahead to hearing from RNIG Rainbow, I just wanted to acknowledge that this guideline was funded by the Government of Ontario. So I'll pass it back to Morgan now. Thank you.
Thanks, Amy. And thank you to Elizabeth and Sheena for sharing as well. We would like to acknowledge the advocacy work of the Rainbow Nursing Interest Group and others who are instrumental in advocating for the need for this best practice guideline. The mission of RNAO's Rainbow Nursing Interest Group is to foster and advocate for nursing practice and environments that support people of all sexual orientations and gender identities and expressions. I'm now going to pass it over to Paul-Andre Gauthier to share details about a new position statement and some closing remarks.
Thank you very much, Madam President. I want to offer our congratulations to Sheena Howard and to Dr. Elizabeth Shewick, co-chairs of the BPG panel, and also to other panel members, as well as RNAO staff, for this tremendous guideline that will provide and offer care to the 2S LGBTQI plus community at home or abroad. Today, we're adding another milestone to the nursing, and also we need to implement this BPG into practice, in our practice, not only general practice, but to our practice, as needed by individual we care for. We are more than being a patient. This is a colonial term, but we are individuals in need of respect by care providers, for example. This BPG will provide excellent suggestions and directions about the care that we all need. Je tiens à remercier les personnes qui furent réviseurs externes pour cette pratique exemplaire qui vient d'être publiée aujourd'hui. Colleagues, the Rainbow Nursing Interest Group is thrilled to be issuing with RNAO a revised position statement on respecting sexually and gender diverse community. At the same time, RNAO releases its newest BPG. Personnellement, j'aimerais remercier mes collègues qui siègent au nom de notre conseil d'administration Rainbow Nursing. Many thanks to our executive members who have done very well. So let's name them because some of you are on the phone and they cannot read the names. It's Danielle Schwartz, Ruth Trainer, Linda Holmes, Christopher Drano, Zev Bernstein, Kashka Aronside, and Kieran Tierra. And we had two individuals who were with us at the time, is Abigail Bowell and Dakota Carey. So the RNIG Rainbow Group, it has been a real honor to work with our members in updating the RNAO position statement. We went from 12-page to 2-page. That's quite an achievement. This was an intensive activity, and I thank the Rainbow members for their commitment and their patience to this very important initiative. I want also to thank Brittany Groom, our colleague who helped us, nursing policy analyst at RNAO, for her genuine interest and effort in understanding and incorporating RNIG's understanding of the 2S LGBTQI+ lived experience and needs in the update of this position statement, as you see on the screen right now. It reinforces the long-standing collaboration between RNAO staff and RNAO interest groups with the benefits to the association and its member and also the public. This statement underscores the need to ensure that sexually and gender diverse individuals feel safe when accessing care, that their experience person-centered, inclusive, and appropriate care, and that the work to foster healthy work environment for nurses and staff. We are all delighted that the position statement will both stand alone and also be an appendix in this new BPG. Yesterday, we passed a resolution at RNAO about 2SLGBTQI+ competency as entry to practice. We need to lobby for that now in the nursing program in Ontario. RNIG is grateful to be a vibrant interest group of RNAO, actively contributing to the diverse and inclusive organization. We thank and congratulate the board of directors of RNAO and the staff for recognizing the needs of the 2SL LGBTQI+ community and for the continuously for acting and to advance our need. Thank you. Merci. Miigwech. Back to you, Morgan.
Thank you very much, Paul-Andre. So now we will be opening for questions. First from the media, please. So we do have CP24 TV News, who has been present and are looking at running a story on this later. If there's any other media colleagues who have questions, if you could just indicate media when you enter your question into the chat box. I don't see any right now, but we'll go through the questions that are in there. And if any media questions come up, we will prioritize those. So the first the first question is from one of our interest groups, PCNIG. So the question is, how will you be looking to ensure that this guideline is part of any publicly funded organization? for any of our panelists who want to take that one.
And I can comment also, Morgan, from an RNAO perspective related to all the guidelines. Do you want me to respond?
Sure, go ahead.
So all the guidelines have a dissemination cycle. They go absolutely to all the organizations. They also go, and this will be important to also to the panelists, to all the politicians and to all the media. And they go to all our 1,000 best practice spotlight organizations around the world. So the comments that before both Dr. Sewick and Dr. Gutierrez were making about, and Sheena also made actually, about the guideline impacting lives elsewhere, will be also through the best practice spotlight organizations. And today in our blog, which goes to 300,000 people, this guideline will be profiled with the link and everything. So rest assured that it will be huge wide dissemination, and that's the case for all the guidelines, and this one, of course, in particular, given its importance. If people have other ideas of where you would like us to send it, and also you can feel free, all of you, to send it out because the link is yours.
I have shared also some answers if you check the Q&R box.
Yeah, so some of the questions have been answered in the Q&A box. So you might see an answer to your question typed in there. Our next question is from Chantel Singh, the Pediatric Nursing Interest Group past president. So as pediatric nurses supporting children and youth who may be navigating this from early on in life, how can we best do so? And how does this guideline address this?
So I can take that. The best practices guidelines is based on trying to identify the evidence from across the life course. And while most of the research and evidence that was drawn on, of course, is focused on adults and on adolescents, there was evidence that included information about children. And when it comes to supporting children and youth who are navigating sexual orientation and gender identity development, the best way that pediatric nurses can support them is to listen to them and to follow their lead and to support their parents in supporting them. And so part of that is actually to role model the affirming and respective interactions with young people in the same way that pediatric nurses do that about role modeling respectful interactions around parenting care. So there is information. There's also links within the BPG to particular resources that can provide detailed support and information for pediatric nurses.
Any of our other panelists? It was a great answer, but I don't want to miss anyone else who has something they want to add.
I would just briefly add that we do have one recommendation that speaks to safer spaces in school environments. So for those pediatric nurses that are working in more of a community or a public health setting, that recommendation would be especially useful for you.
Okay. Thank you. We have a follow-up question from the Palliative Care Nursing Interest Group. So their follow-up question is, they're wondering, however, since it's been funded by the ministry, will there be a mandate for its implementation in publicly funded social services and healthcare?
So I can comment again on that, given the impact on all the guidelines. No, we cannot mandate any guideline. It reminds me George Smitherman, the minister at the time, about why are these guidelines not mandatory? And my answer was because every professional will fail if they were mandatory, because we are not up to standards on many of them. But yes, encourage in all of them, and not only on the publicly funded. This is equally necessary in private schools, in private organizations in other countries. People in the community require best care, regardless in which settings they are. The professionals need to respond with best care, and we are very hopeful this guideline will advance that. But given that we push it in so many ways, we are very optimistic that this will have a tremendous impact. The team also will be doing webinars, and we will not only do them in English, we will do them in French, we will do them in Spanish, we will do them in Chinese. So different communities, both at home and abroad, can benefit.
If I can add to that, I know some of my colleagues from the French community for the 2SLGBT community, we had meetings in the last few months, and they're really looking forward. If we can get a French version, they will appreciate
it. Paul Andre, take it as done. Take it as done. Let them know, not only in French and in Spanish. Spanish, they all get automatically. Take it as done. Very good point. Thank you.
And if I can add, although it's stated at this point, it is important to remember that both the federal government and the provincial governments have included sexual orientation and gender identity and expression in their human rights protections. And so there is, as one of our fellow BPG guideline group members has pointed out in the answers in the Q&A, we can't mandate the guideline, but these are protected human rights. And so we can advocate for healthcare systems to actually take up and enforce the Human Rights Code by actually providing the best practices to support all people.
I really feel very inspired with your comments, both you and Paul Andrea and Sheena and all of you. I think what we will do next, because the question was a brilliant question, is that we will call a meeting, Amy, with Dr. Siwak, with Dr. Gutierrez, with Madame Sheena, and we will strategize, are there other ways by which we can advance this? And probably with a couple of colleagues from other countries where they're more compromised even than here. So we will do that. Expect that give us a breather, but we will do that in the next month or so.
Okay, there is another question about, does this guideline address palliative? The question disappeared, but it was about palliative care and end-of-life care for the 2SLGBTQI plus group.
I can make a comment. I did answer a little bit that one. All the information included in the BPG can be used in any area of nursing practice. And don't be shy to use them, because you never know. People may not have disclosed they are from our community. So respect and also ask questions. What pronoun should I use when I work with you? Some will say it's them instead of he or she. So just be open about it and then be respectful. And if you notice some aspects of their person that may be from the LGBT community, just ask. Just ask them, is there any way of should I address you and with pronouns? And then if they say, no, I'm straight, that's all good. But if not, I mean, there will be a way to respect individuals.
If I may add, I wanted to say thank you so much to the RNAO for initiating this BPG, but I'd also like to invite my cisgendered and heterosexual colleagues to take up this work as well. So much of this work is being done off the backs of the 2SLGBTQI plus providers, educators, and patients. So this is a special call out to you to listen and to use this BPG and push it forward. Thank you for listening.
And also help our fellow colleagues who are nurses in their work environment. Sometimes they're not fully aware. And other healthcare professionals, sometimes they need to be reminded, no. You may see a person that you're not used to care for, but just be careful. Don't dismiss them, because prejudice, stereotype, and discriminations are really close by. And if we don't pay attention, 30 years ago, when I did my master in nursing, working with the people who are HIV positive, the men and women, HIV positive and AIDS at the Montreal, I can tell you, I've seen a lot of it. And sometimes it's still the same today, 30 years later. So we have to be careful and respectful. Respectful, if I can not say, repeat it again, respectful.
Thank you so much to all of our panelists for your very thoughtful and insightful comments, and for answering all of the questions, and for the tremendously hard work that you have put in to developing this guideline and the position statement. Thank you so much to our home office staff as well for working on this very important guideline. Once again, RNAO is leading the way by creating a much needed resource for nurses, other health providers, and members of the public, so that everyone, regardless as to how you self-identify, can feel safe and receives the dignified and appropriate care that you deserve. So thank you again, everybody, for joining us to hear about this very important best practice guideline.
Morgan, before we close, I want to thank, in addition to the panelists that were thanked and also Rainbow Nurses, I want to thank the team that really worked on it from home office day and night. And I do say day and night because towards the end was day and night that we were at it. So Amy, of course, she was part of the panel. Deborah Flores, amazing. Go high, Deborah, so they know who I am saying. Nafsin Nizum, who oversees the guideline development, and Glynis, you for your help with all of the logistics of everything. Glynis Kittens, thank you so very much. The fruit of your minute-to-minute labor, and of course of the co-chairs and the panel, you did good for the people of the world. You did good for the people of the world. And I want also to point the inclusion of seniors. We talked about all the sectors, we forgot seniors. It's not only about children, it's not only about palliative care. And we included seniors during the pandemic. You need to know that we have lots of issues on seniors, and was Deborah Flores that brought it to my attention with Amy Bird. Seniors had a lot of issues of being discriminated when they went to see their loved ones. So the inclusion of seniors is very important, because that's an issue of practice change for your sector, Morgan, for long-term care. There is a lot that needs to happen in that sector too. Thank you very, very much. A big moment for Ontario and for the world. Ontario made for the world. So thank you to all of you.
Thank you very much.